It's hard. Like it's not.
Well, it wasn't like really cheating. My friend took it and he said all the demos that they show when you actually have to do assignments, they are the same answers, and it's true. They're the same answers. Yeah.
Oh.
Yeah.
Well,
So.
makes it easy in some way, I suppose.
I noticed that in Alex's exam because I take really thorough notes when I was in Alex, and when I refer back to them, I usually get really similar problems.
Yeah.
The Alex system was it was like looking up your medical disc, but one part, like if you answered it wrong, it resets you to the beginning and stuff, and you're like, oh, I just did everything all over again.
Yeah, I think there's some holes in the program.
XYZ was cool.
Musculoskeletal system. Not the statistical system, but the musculoskeletal system. So, muscles and skeleton. You know, the nerves make up the third part of this, turning everything on, but we're going to do the nervous system separately. So we're going to be identifying the names of all the parts. And, of course, in A&P 1, you memorize every bone, every muscle, the attachments, and all the articulations of the joints and all that. But here we're just going to go over some fairly general ones, not in that kind of detail, but that way we'll be able to give them their scientific terms, their medical terms. Muscle, bones, bone marrow, joints, cartilage, tendons, ligaments, and bursa. These are your parts. 206 bones, 600 muscles. It's a lot of stuff to memorize in A&P 1, but it usually turns out quite well. A joint is where two bones articulate. That means they move against each other or touch each other. Generally speaking, there's cartilage where those bones are. If it's a movable joint, you have articular cartilage on the ends to give them lubrication and some cushioning. If they're a tight, immovable joint, they're usually held together by a fibrocartilage of some kind. The bursa is a bag of fluid that goes over an articular surface to keep a tendon from rubbing against it too much. Movement, skeletal muscle. We're not talking cardiac muscle now or smooth muscle. We're just talking skeletal muscle, primarily voluntary, not entirely. There are some skeletal muscle features that are pretty much automatic. Innervated by the somatic nervous system, meaning body, because it moves your body. Posture, stability of the joints. Although you have ligaments holding your joints together, a lot of the stability comes from those muscles holding the joint into place as well. Heat production. Your skeletal muscle is your primary source of body heat, and it's what makes us warm-blooded. We produce more heat than we need. It's constantly being sloughed off, and the balance keeps our temperature where we want it, even if we're in cold weather or hot weather. The skeletal system, then, it provides the structure against which the muscles pull. It also provides protection, especially for the brain, the heart being right behind your breastbone or your sternum, your pelvic girdle supporting some of your and protecting some of your pelvic organs. We also store calcium and phosphates inside the bones, so that because calcium is critically important to maintain in your blood for the operation of muscle, smooth muscle and cardiac muscle especially. And also our flat bones have marrow in them that makes our blood cells. Red blood cells, white blood cells, and platelets all come, for the most part anyway, all the red blood cells and most of the other stuff too, comes from flat bone marrow. The bone itself has a fibrous layer on the outside that has a lot of nerves and a lot of blood vessels in it. It's called the periosteum. Peri always means around, surrounding, on the outside. Osteo is the term for bone. So periosteum is an outer layer. It's not bone itself, but it contains a lot of stem cells or bone-producing cells that can work on the outside of the bone to help the bone remodel when it needs to reshape itself or heal itself. Then you have the hard outside bone layer, which is called compact bone. Inside you have spongy bone, also called cancellous bone. And within the spongy bone is where you have most of your bone marrow. In the long bones, it's mostly yellow marrow, which gives you nutrient storage. In your flat bones, you have red marrow, which makes blood cells. Then inside the bone, there's a hollow medullary cavity that has your bone marrow in it. And the inner lining of the bone itself, lining that, is the endosteum. So your bone, your compact bone, is sandwiched between the periosteum and endosteum. Then inside the medullary cavity, you have your bone marrow. On a long bone, the diaphysis is the long part. The epiphysis is at the ends. Epiphysis. And in between the two, you have a little line or a plate called the epiphyseal line or epiphyseal plate, called growth plates in kids, because that's where most of your bone growth occurs. It doesn't grow in the middle of the shaft. These parts grow, and the epiphysis gets farther and farther apart. And as it grows, it remodels into the right shape. Red marrow for making blood cells, yellow marrow for nutrient storage. This is a long bone. There's the diaphysis. There's the epiphysis. There's the epiphyseal plate or growth plate. There's the cancellous or spongy bone in here, compact bone, periosteum on the outside, endosteum on the inside, bone marrow in the middle. These are long bones, so they have yellow marrow that's mostly fat. Your skull bones are called cranial bones. The upper jawbone is your maxilla. You actually have two of them that fuse together. The mandible is your lower jaw. The vertebral column is made up of a bunch of vertebrae piled one on top of the other. At the top, you have the cervical vertebrae. You know that people have cervical collars if they hurt their neck. And that's the first seven. C1 through C7 are the cervical vertebrae at the top. And they're named that. The first one is C1, C2, C3, C4. And then you have the thoracic vertebrae, 12 of those. And each one has a pair of ribs stuck to it. So wherever there's a rib, you have a thoracic vertebra. 12. What's that?
Have you heard of the breakfast, lunch, and dinner? And breakfast at 7, lunch at 12. Is it 5?
Yeah, 5. Dinner at 5? Who eats dinner at 5? Breakfast, lunch, and dinner. Breakfast at 7, lunch at 12, and dinner at 5. Okay? Yeah, because you have C1 through C7, T1 through T12 are the thoracic, and then L1 through L5 are the lumbar vertebrae. Most damage tends to happen to your neck and your lower back. The ribs help hold the other guys in place, so you're less likely to damage a disc or something in the middle than you are in the lower back where there's so much movement and pressure, or in your neck where there's tons of pressure too. The sacrum is below that, and you have 5 vertebrae there, but they're all fused together. So the only one you need to know is S1, because L5-S1 is a joint that is always herniating. The coccyx is usually 4 little vertebrae that are fused together. At the bottom of the sacrum, it's your vestigial tail. All it's useful for is hurting if you land on your tailbone. lamina, part of the vertebral arch. Each vertebrae has an arch that has a body that supports the weight, and then has an arch that the spinal cord can go through. So the vertebral arch, the lamina is part of that arch. If you have a laminectomy or something like that, you might have to open the vertebral arch some because you have a stenosis. Our main skeletal bones are the clavicle, your collarbones, scapula, shoulder blade, the sternum, which is your breastbone, and then in the arms you have the humerus is the upper bone, the radius and ulna are in the lower arm, radius on the thumb side. Carpals are wrist bones, metacarpals are hand bones, and phalanges are finger bones. We name our digits. Your thumb is number 1. 1, 2, 3, 4, 5. So this is the middle phalanx of digit number 2. This is the proximal phalanx of digit number 1. So that's how you would describe it in medical terms. And X, the plural, always has the NG, like salpinx. You have salpingo or salpinges when it becomes a plural thing. So the one phalanx, but multiple phalanges. Your pelvic bones, you have 3 bones that make up the pelvic girdle. They are the ilium on top, the pubis in the front, and the ischium in the back. Your sit bones, or ischium. Since the iliac bone interacts with the sacrum, you have the sacroiliac joint there, which people like to refer to whenever they have back pain. They're usually wrong. It's usually not the sacroiliac joint that's hurting, but if it hurts there, oh man, my sacroiliac is acting up. So you have those 3 that make up the pelvic girdle. Then the thigh bone is a femur. Your patella is your kneecap. Your tibia is your big shin bone. And the fibula is the smaller lateral bone in your lower leg. You have 2 bones in your lower arm. You have 2 bones in your lower leg. Tibia, fibula. Your tarsals are your ankle bones. Metatarsals are your foot bones. Phalanges are your toe bones. Just like fingers and toes get the same name. But your wrists are carpals. It's easy to remember. Carpal tunnel syndrome is a wrist problem. It's not an ankle problem. So your carpals and metacarpals are in the hand and wrist. The tarsals and metatarsals are in your ankle and foot. Anterior view, cranial bones, the eye orbits. It's useful to know that, called that. You can break the orbit if you hit your face on the steering wheel in a car accident. The maxillary, upper jaw, mandible, lower jaw. You have some nasal bones right on top here that can get broken too. Cervical, thoracic, and lumbar spine vertebrae. Here you have the sternum. Sacrum, sacroiliac joint, the ilium, the pubis in the front, the ischium on the back. Clavicle, scapula, humerus, radius by the thumb, ulna, carpals, metacarpals, and phalanges. Femur, patella, big tibia, little fibula, tarsals, metatarsals, phalanges. Okay, now you don't have to memorize a lot of that stuff right now, but if somebody has a broken femur, you ought to know what it is. If you break your radius or ulna, I mean, those are things you break a lot, so you ought to know those. And you ought to be able to say if somebody's in a car accident and they break C1, okay, that's the very first vertebrae at the top of your spinal column. Posterior. Joints come in a couple of different types. They can be very fixed, like the ones that hold your various head bones together, or they can be movable joints, and those are the ones that we usually have problems with. Your shoulders, your elbows, your wrists, your hips, your knees, your ankles. Those are things that you're always breaking and spraining and getting repaired and stuff. And on the ends of the bones, you'll have an articular cartilage that makes them nice and slippery and soft to move against each other. You sometimes have extra structures to give some depth and structure, like the menisci in your knees. You have a medial and lateral meniscus. They're like plastic cups that your femur bones fit down into to hold it more stable. It has ligaments on the side holding it together, and then muscles around that to cause it to move. And the capsule is filled with fluid. It's like, you know, a sealed wheel on your car that has grease in it all the time, and it keeps everything nice and lubricated so that it moves well. But it gives you a place to have an inflammation, an infection, a torn capsule, a torn meniscus, a torn ligament. All of those things happen a lot. Intervertebral discs are the discs between your vertebrae. They are jelly donuts. They have a nucleus pulposus in the middle, which is jelly, and on the outside you have an annulus fibrosus, which is the hard thing that holds the jelly in. And it gives you some impact and the ability to move your back around some. But they can also herniate. Herniated discs have to be fixed somehow, either surgically or through physical therapy. The pubic symphysis is a disc right between the two pubic bones on the front that holds the sides of your pelvic girdle together. On females, those will loosen during childbirth and let some extra movement of the pelvic girdle to help the baby come through. Movable joints are called synovial joints because they have a synovial capsule filled with synovial fluid. The bursa are little bags of synovial fluid that protect the surface of the bones and the surface of the tendons that are rubbing across each other. We know about bursitis, very painful. It's really easy for these guys to get mushed and scraped and inflamed. Ligaments hold bones to bones. Tendons hold muscles to bones, attach muscles to bones. And an aponeurosis is like a tendon that's this wide. It's a piece of connective tissue. You have some that go down the middle of your body here. You have one that goes over the top of your head that connects your front of your head muscles to the back of your head muscles. An aponeurosis. Just a big, wide, tendinous sheath kind of thing.
My little sister, with her congenital heart, it caused her not to have a thumb on her, and they actually created two other fingers, or a finger. They created a thumb, and they got the tendons from her feet and then put it into her thumb. So now it's movable, and it's weird. It doesn't even look like, it's insane.
Does it actually work pretty well?
It works.
Wow, creating a thumb where one wasn't there. Yeah.
And then on this hand, the thumb wasn't working, so they did the same thing. So now she has it's pretty insane to see it happen. Yeah.
Wow. Cool. Neat. So anyway, we have the femur coming down. Here's a knee joint. The menisci are down here, meniscuses that give you a cup to sit in, gives it some shock absorption and allows a certain amount of movement in the knee, which you think a knee just moves this way, but actually there's a decent amount of other flexibility going on there. bursa here underneath the tendon to protect the tendon. Patella, the patella has bursa behind it too. They tend to inflame and it hurts. Medial and lateral collateral ligaments. You've heard of breaking your ACL, your MCL, your LCL. Skeletal muscles are striated, so these are all going to be rhabdo something or other. We're not going to have leo, which is smooth, or cardio, which is cardiac. We're going to have rhabdomyo problems. They pull. Muscles only pull, so they're attached to two different bones across a joint, and when they pull, the joint moves. Smooth muscles don't have striation, so they look smooth. Cardiac muscle forms the heart wall, but that's not exactly musculoskeletal. That's more we've talked about, the smooth muscle that's around, the cardiac muscle causes your heart to beat, and the smooth muscle is surrounding all of your tubes. Surrounds your blood vessels so they can constrict or relax. Surrounds your stomach so it can contract or relax. Your intestines, your uterus, your fallopian tubes. You have all kinds of muscular walls. So the types of body movements that this can allow, there are more than this, but this is going to do for this class. We're going to abduct and adduct. Abduction is to take away. When you abduct somebody, you take them away. Adduct, you add back to the body. This is a sideways movement in the frontal plane. Abduction and adduction of the hip, of the shoulder, is in the frontal plane. Flexion and extension from the anatomical position. Flexion is bending your joint out of the anatomical position. Almost all of them bend forward. Flexion of the elbow, flexion of the shoulders. Extension is putting them back. Flexion of the hip. Only the knee bends the other way. Flexion of the knee goes that way. And extension is returning to the anatomical position. Flexion, extension, and if you go beyond, it's hyperextension. You can hyperextend your shoulders just fine. They're supposed to. You can't hyperextend your elbow without doing damage. So when you talk about, well, I hyperextended my knee, yeah, it only extends that far. If I hyperextend it, I'm going to break something in there. Inversion and eversion happens at the ankle. Inversion, your foot turns in. Eversion, it turns outward. The sole of your foot. Invert, evert. Dorsiflexion comes up. Dorsal fin on a shark is up. Plantar flexion is toward the sole of the foot. Dorsiflexion, plantarflexion, inversion, eversion. Circumduction is this. And rotation is simply around a axis. Rotation of the trunk, rotation of the neck, rotation inward, exward, rotation of the shoulders.
So I heard pronate before, and I was looking right here. So pronation, it showed as like the front, and this was supination?
Yeah, with the hand, remember prone is lying on your stomach, and supine is lying on your back. So for the whole body. So if you take your hand, if you put it on his belly, if you put it down, that's pronation. Supination is putting your hands on their backs. Pronation, supination of the hands. Yeah, on your front, on your back. To be prone or to be supine. Now they call the ankle movement inversion and eversion. Although, if somebody has a pronated foot, it means they turn in like this. I mean, it's the same thing as your hand turning this way gives you pronation at the foot. My feet pronate a little bit. I have more weight on the inside of my foot than I do on the outside of my foot. So even though it's not considered a directional movement with the ankle, which is inversion and eversion, is considered a condition. If you have pronated feet, it means that they're turned in a little bit. Not the toes in, but rocked in on the inside of the feet. No pigeon toed. Pigeon toed means your toes turn in. Pronation is this. It's rotating your feet this way. If you're knock-kneed, you tend to be pronated. If you're bow-legged, you tend to be supinated. Your foot is kind of rocked on the outside. So somebody that walks along like this and wears out the outside of their shoe, their foot is a little bit supinated. For me, I wear out the inside of my shoes faster. Mm-hmm. And I'm a 16th Cherokee, and Native Americans tend to be slightly pigeon-toed. If you look at pictures, of the squaws standing there, always kind of pigeon-toed. And they sometimes credit that with being able to walk so silently. And so the fact that I'm slightly pronated and slightly pigeon-toed, what I do is I say, yeah, well, that's because I'm a Native American. I brag about it, I'm happy. So here's flexion, extension, pronation, supination, abduction, adduction, inversion, eversion, rotation, those kind of motions. And since the muscles are causing these, well, the patient complained during inward rotation of the left shoulder, and the diagnosis turned out to be bursitis. So knowing some of those motions, wow, it hurts every time I, like the old joke, Doc, it hurts when I do this. Well, don't do that. Carpo for carpal, wrist bones. Clavico or claviculo for your collarbone. Costo, not Costco, that's where you go to buy stuff. Costo is ribs. So your costal cartilage connects your ribs to your sternum. Your intercostal spaces are the spaces between the ribs. Your intercostal muscles and nerves are the ones between the ribs. Cranio for cranium. Femoro for femur. Fibulo for fibula, your little bone in your lower leg. Humero, ilio for the ilium. Ischio for your ischium. Lumbo for your lumbar spine. Mandibulo for the lower jaw. Maxillo for the upper jaw. So these are all really named well. I mean, there aren't very many, except for, it would be nice if this were ribbo, but it's not. Costo. You go to Costco if you want to buy really cheap ribs. If you're having a barbecue or something, you got to get a whole bunch of them. You go to Costco. Yeah, right. What? Chondritis? Well, chondro is the term for cartilage. So costochondritis would be inflammation of the ribs and cartilage, rib cartilage. Yeah. Patello for the kneecap. Patellar tendonitis is a common affliction. Pelva for your pelvis. Phalangio for phalanges, for fingers and toes. Pubo for pubic. Now here we have, unfortunately, this is like hystero and metro and stuff for the uterus. We have a couple of different things we use for the vertebrae. You can say vertebro. You can have a vertebral disc. You can have, a herniated vertebral disc. So vertebro is used. Ratio is used in a couple of conditions, and so is spondylo. So all of these three are going to relate to the vertebrae in some way. Radio for the radios, sacro for the sacrum, scapulo for the shoulder blade, scapula, sterno for your breastbone. So the sternoclavicular joint is between the clavicle and the sternum. It's right here. Tarso, tarsals. Tibio, ulno. Just named after the bone. All you have to do is, if you don't know the names of the bones, all you have to do is memorize the entire body and you're okay. No problem. It's so easy. Aponeuro for aponeurosis. Arthro, we know that's joint, right? We did that the very first day, arthritis. Burso for bursa, so bursitis. Chondrocartilage, chondritis, chondrosis. Disco, John Travolta. Vertebral discs. Menisco for the meniscus. Synovia for the either the joint or the capsule, the fluid or the capsule. Teno or tendino, depending on what the rest of the word is, you either add a D and an IN or not, but they all are about the same. Tendino, teno. So here we have ligaments. That could be ligamento. Synovial membrane is what? Synovio. Meniscus? Menisco. Joint? Arthro. Tendon? Tendino. Teno. Tendo. Nintendo. Articular cartilage? That doesn't show it very well. The articular cartilage actually goes all the way across, but it's called, what's cartilage? Chondro. Bursa, burso. Some things that you can describe the condition of these bones or joints. Ankylo means crooked and stiff and bent. It's like you're crooked and stiff. Those are not exactly the same. Crooked and bent, but ankylo is somebody that has ankylosing spondylosis. It just, they walk around like this. They can't straighten up. Kinesio, like kinesiology, is movement. So you can have hyperkinesia, where you can't stop moving. You might have bradykinesia if you have Parkinson, so you have a hard time moving. Kypho is an outward curvature of the spine. Everybody has a kyphotic curve in the upper back and in the butt. Okay, but kyphosis is a bad condition of that curve. So a hunchback is called kyphosis. In the lower back, it's called lordosis. It's the sway back. So a lordotic curve is what you're supposed to have, but lordosis means it's too bad. Lamino, the thin layer, laminal layer. We know that myo and myso or myoso, we'll see that they put an S in it on a couple of things, but we know that myo is muscle. Myelo. Where do we know myelo from? We have bone marrow, and we're going to have spinal cord. Okay, myelo. So when we had myelomas, this was in the blood system. Your bone marrow had to make the red blood cells. So we've already seen myelo once before, but it means the middle of, and so this is your bone marrow. Osteo is bone, osteoarthritis. Petro means stone, like a petroglyph. So litho, lithotripsy for that kind of stone. But if your bones become stone-like, there's a couple of conditions that cause the bones to thicken and harden so that people can't move and can't breathe and stuff, and they use the term petro. Scolio means curve. Scoliosis is a back that curves sideways. So you have kyphosis, lordosis, and scoliosis. Inter is between. Intra means within. I always remember intercollegiate athletics. It's between two different schools. Intramural sports are within the same university. Inter means between two different things. Intra means within it. Supra, above. Sim or syn means joined. Okay, synovial fluid actually is fluid that joins the joint together. But we're going to have some conditions where bones might fuse together or something. Asthenia actually means strength. A means without, you know. Asthenia is a term for weakness. Myasthenia gravis, muscle weakness, very grave muscle weakness. Myasthenia gravis. Clasia or classis or clasp means to break apart. So in some cases, you're going to have to break apart a fused joint, or maybe even re-break a bone that healed wrong. And if you remember your osteoclasts, that are cells that break apart bone, the whole idea of a clast is to break things apart. Desis means to fix them together. So if I'm going to fuse two vertebrae because I've tried fixing the disc and I can't, and it hurts too bad, we got to fuse you know, L4 and L5. So this is going to be a something or other desis. Physis means grown together. So if we have a symphysis, it's like the thing that helps joins the two bones together. A schisis, we know what that is. We saw the omphaloschissus or the gastroschissus when the stuff was outside. It's an extra break in a bone, an extra hole or something where stuff can go through. Symphysis means together joined, or joined together would probably work too. Okay, so how many things can go wrong with the musculoskeletal system? Plenty. Ankylosis, abnormal stiffness, usually stiffness in a bent posture. Arthritis, we know what that is, joint inflammation. Bursitis, bursa inflammation. What would chondromalacia be? Of cartilage, softening of cartilage. It's actually a disease, and the cartilage on the end of the long bones gets so soft that it deteriorates and you have a lot of pain and deterioration and stuff. Cranioschissus, a hole in your head where stuff comes out. Discitis. Fibromyalgia. This is pain in fibrous tissue or connective tissue and muscles. Fibromyalgia is a general term for a condition where people have pain in a variety of muscle and connective tissue areas that can't be explained by any particular disease.
Is that why some people say that it's like there like people that don't believe in fibromyalgia or something like that?
Yeah, that it's like because you can't find, or we haven't found the cause for it yet, therefore it must be all in your head. You know, you must just be making it up. As though we're so smart, we know the cause of everything. And therefore, I mean, you're in terrible pain, but I don't believe it because I don't see the whatever. Well, it's because I don't know what to look for yet. You know, 10 years from now, we'll find out, you know, but right now we don't know. I mean, you could say the same thing with some other pretty serious disorders that we don't know what causes them yet. Kyphosis, the humpback. Lordosis, the sway back. Maxillitis, pain in your upper jaw. Meniscitis, inflammation of the medial or lateral meniscus. Myasthenia, muscle weakness, muscle lack of strength. Myeloma, as a tumor of the bone marrow. In this case, the myelomas are cancerous. Osteitis, bone inflammation. Osteoarthritis, both. knee joint, osteoarthritis, rheumatoid arthritis. Osteoarthritis happens because you have been alive a long time and you wear out stuff. And the more it wears, the more stuff scrapes. The more it scrapes, the more inflamed it gets. Pretty soon the inflammation starts deteriorating even more, and it can become super serious. Rheumatoid arthritis is an autoimmune disease where your own immune system is attacking the joint, and the synovial fluid itself gets cloudy and thick and inflamed.
So osteoarthritis and rheumatoid arthritis are not the same thing.
They're totally different.
Totally different, whereas people will use just the term arthritis.
Yeah, I have arthritis. Usually if somebody says they have arthritis, it's osteoarthritis, because everybody gets it to some degree. You know, I've used my hands so much. I did a lot of construction, and I did, worked with horses and stuff, and it hurts a little bit, sometimes, especially if my hands are cold. My knee was damaged, and I got it repaired, but it doesn't feel great. There's probably some arthritis in there, and it'll probably get worse with time. And that's, if you have rheumatoid arthritis, it's a diagnosis that's totally different. And you may have never been an athlete. Your cartilage may be otherwise in perfect shape, but it's all inflamed because your immune system's attacking it.
So then the name rheumatoid looks like, what would rheuma?
Well, a rheuma is a pain. This was named before they knew what it was. And it was swelling, just swelling and painful in somebody who had no reason necessary. They'd never had injuries to these joints, and yet the hands were getting all crippled up, and and they have actually rheumatoid factors that they can look for in the blood to see if you actually have that. It's more like being diagnosed with lupus or something. I mean, it really is an autoimmune disease. Osteochondritis, bone and cartilage. Osteofibroma, a tumor of the fibrous tissue of the bone. Remember, you have fibrous tissue on the outside, you have fibrous tissue on the inside, the periosteum and endosteum. If those cells start overgrowing, that's where it can start from. Osteomalacia, softening of the bones. In many cases, better known as rickets, somebody who either had an inability to absorb calcium, inability to utilize calcium, or insufficient calcium or vitamin D in their diet, or whatever. Their bones don't grow long, and they are soft, and they curve outward.
I got diagnosed with osteochondritis, and it's benign. It's like, if you look on a CT scan, it looks like a bunch of white spots on your bone, but it's benign or something. It's like a hereditary condition with like a mutated gene or something like that. I don't know.
Huh.
Yeah.
Haven't heard of that one.
Yeah. As long as I'm not dying, okay.
Yeah, you can still run around, right?
Yeah, it's not serious or anything. I think it's like, it's very common. It's just, my doctor didn't see it at first, and they like freaked out and like sent me to all these specialists, and it just turned out to be nothing.
Osteomyelitis, inflammation of the bone marrow. Osteopenia, not enough bone mass. Remember, penia means not enough, like erythrocytopenia, osteopenia. Osteopetrosis, a stoning of the bones. They get heavy, hard, and brittle. Osteosarcoma, malignant tumor. Poliomyositis. We're going to see polio in a second. It's kind of interesting. Polymyositis, inflammation of many muscles. Reishi. This is where we use reishi as spine, spina bifida. It's an opening of the spinal column. They couldn't have called it spinoschisis, could they? That would have been too easy. This is where we get to use reishi.
Is osteopenia kind of a precursor to
Yeah. I mean, people can have osteopenia if they're young, and they may not have osteoporosis, and it may be because their diet's bad and they can improve it. But as people get older and older, they will first, when you drop anything below normal, you're considered an osteopenia. When you drop below about like 50% of the density you should have, you're in true osteoporosis. Rhabdomyolysis. Dissolution of skeletal muscle usually happens if you have impeded blood flow, ischemia to the muscle, the tissue starts to break apart and go away. And skeletal muscle you really don't replace. You know, if you, when you hypertrophy skeletal muscle by exercising, those fibers that you already have get bigger. So if you lose a bunch of them, you can hypertrophy the other ones, but it's hard to replace them very well. So if you have a compartment syndrome or something that puts so much pressure on your lower leg that it causes the muscle to start dying, it's hard to really recover perfectly from that. Sarcopenia, insufficient muscle, old people. Or if you have muscular dystrophy or something and your legs get skinny. Scoliosis, spondyloarthritis, curvature of the spine. Spondylo, remember that's another spine word. Spondylosis, an abnormal condition of the vertebrae. Synoviosarcoma, that kind of makes sense. Tendonitis, tenosynovitis. We're talking about the synovial fluid and tendons around there. Is that yours or mine? Back there, it sounds like mine. No. I'll get it when we take a break here. Softening of the bones would be what? Uh-huh. So some disorder terms, ankylosing spondylitis. So what does this mean? Causes you to be bent and stiff and inflammation of the spine. It's just a name of a condition. A bunion on the big toe, generally, a painful swelling of that joint, and it sticks out to the side. Carpal tunnel syndrome, usually from repetitive work, like cutting chickens apart in a chicken factory, and people get, or cashiers. You know, I see a lot of cashiers that have to wear a brace on their wrist because just doing this all the time will inflame the tendon as it goes through the sheath and cause carpal tunnel, which is so painful you have to pretty much stop doing stuff.
Is it different than tendonitis?
Well, it's more a more thorough inflammation of tissue than just the tendon. I mean, you can have tendonitis in your shoulder, you can have bursitis, you usually have some combination of both. But carpal tunnel, the tendon and the sheath that holds it and stuff swell up to the point where they don't move through the area very well anymore. And I actually got it one time. I was, when my wife's gallery in Atlanta, she had this beautiful antique and folk art gallery that was like 4 times the size of this place here. And we had, it looked like a general store, and up front we had an ice cream freezer with like 16 flavors of hand-scooped ice cream. And one Saturday, the first Saturday we had the thing, I had so much fun, I scooped like 450 scoops of ice cream because we kept track. And like for a week afterward, I couldn't move my wrist. That was like getting tennis elbow or something, but I mean, it hurt so bad, I had to scoop right-handed or get somebody else to do it. I couldn't do it. Bummer. Ice cream wrist. Cole's fracture, very common fracture from people. When you fall, you have a tendency to put your hand out like this and land and go and break the bone right at the end, right at the down in at the wrist. Exostosis, kind of a weird word, but it means growing outward. Exo, I mean, it kind of makes sense. abnormal bone growth that sticks out, forming bone spurs, except they can be bigger than that. Oh boy, another X, fracture. Gout is inflammation of joints, especially in the knees and feet, and most commonly in the base of the big toe. It swells, it hurts, it gets red, hot. I had gout one time for a short time. There's kind of no accounting for it. It's a buildup of uric acid in your blood, and it forms uric crystals in the joints. And it just hurt to move around. And I remember we went on vacation, and I was like having this good time at the beach. I was just hanging out, and I walked across the deck and hit my toe against a chair leg or something like that. And I thought I was going to have to go to the hospital. It hurt so bad. Herniated disc. That's when the firm outer part of the disc gets weak and starts bulging out or losing its integrity, and the goo starts to squeeze out from between the discs, between the vertebrae. Lyme disease is a joint inflammation or muscle inflammation from the deer tick. Muscular dystrophy is a muscle wasting disease. It means bad development of muscles, but they actually get worse and worse and worse until you can't move anymore. Myasthenia gravis is weak muscle grave. Okay, and this is a condition where you lose your receptors on the muscles so that the nerves can't stimulate them properly. And you just get weaker and weaker, and people, it starts in the face, and their face sags, and their eye droops, and then it works its way down into lower body muscles. There are pretty good treatments for it. Osteoporosis, porous muscles. They lose a lot of muscle mass, and they become more air than bone. Bone. Did I say muscle? Bone. More air than bone. More air than bone. Plantar fasciitis, if you've ever had that, that's just remarkably painful. Your plantar fascia is an aponeurosis that goes across the bottom of the arch and kind of holds the arch up from the ball of the foot to the heel. And when you run a lot and stretch it a lot, it can become inflamed, and it can hurt so bad that you can just barely walk on it. Fortunately, I had an athletic trainer give me magical treatment for it that worked so well that I've managed to cure several people, including myself, of plantar fasciitis. I got it the worst when I decided, I was working out, competing at the U.S. Open, and everything I could do to work out more. If I can think of some way to work out more, it's dark now, what do? I'm going to jump rope. And so, and I got shin splints, and I got plantar fasciitis. Rheumatoid arthritis we talked about. Spinal stenosis means the opening gets too small and starts squashing the spinal cord, usually causing a lot of pain. Spondylolisthesis is a degenerative disease of the vertebrae that causes them to shift out of position. And that causes stenosis in there and causes pressure on roots, nerve roots and stuff, and very painful. Take a break. Well, and the good thing about anti-inflammatory stuff in general is sometimes it's the inflammation that's causing the inflammation. Because it's inflamed, it's swollen, and it's rubbing. If you can ever get it to go away in the first place, sometimes it'll stop rubbing and won't come back. So some people will have a bad knee problem and they'll get a steroid injection and it clears it up and it doesn't come back. In other people, it's just kind of a temporary fix. So anyway, here we have our kyphosis, hunchback, our lordosis, sway back. Yes, that's working. Spina bifida, rachisis. It's really called spina bifida a lot more often, I think. Bunion, hallux valgus. A valgus is pointing in that direction, and hallux is a term for big toe. So if somebody's big toe points way in like that because they wore pointed shoes their whole life, and the bunion sticks out on the side, so hallux valgus is a good term for that. Exostosis, a bone spur, an outward growth of bone that's probably rubbing against something. Herniated disc, slip disc, they'll call it, a ruptured disc, a herniated disc, herniated intervertebral disc, herniated nucleus pulposus, meaning the center goo is coming out. A ruptured disc is actually worse. You know, a bulging disc, almost everybody's got a few bulging discs. You know, if you have an MRI, you'll see that some of them are, wow, I wonder why that doesn't hurt. Herniated means that it's lost its integrity, and so it's kind of a balloon sticking out the side, but it's still in there. Ruptured disc means the goo's coming out, you know, and so those are worse and worse and worse versions. Carpal tunnel. The nerve itself is being impinged by the swollen tendons and the swollen retinaculum. It's a sheath that holds the tendons down and everything. It's kind of a combined wrist problem. Spondylolisthesis, a degenerative disease that causes a shifting and therefore causes, you know, a pinching of whatever is coming out at that point. Spinal stenosis, you've got some, like a bone spur growing in there, it's making the hole too small. At least they don't call it rachistenosis. Aponeuropathy. That's sewing up an aponeurosis. So if you have one of these wide sheaths in the side of your leg or something is, you know, part of the iliotibial band or something, an aponeurosis that has gotten torn, you would suture it back up. Arthrocentesis, water on the knee, you're taking some of it out to see what's in there. Arthrochalasia, breaking loose a stiff joint. Arthrodesis, fusing a joint where there's so much pain there that you can't afford to have it moving anymore. Arthroplasty, bursectomy. All these should make sense, right? Carpectomy, taking out a wrist bone. It's not, if you break the scaphoid or navicular bone in your wrist, it's kind of a peanut-shaped bone, and one half of it gets its blood supply from the other half. And if you break it, sometimes it's really hard to get it to grow back together. And if it doesn't, it dies in there. You know, it doesn't work. Chondrectomy, taking out what? Cartilage. So meniscectomy, you know, you might take out the meniscus, but it's also, since it's cartilaginous tissue, it could be called chondrectomy. Chondroplasty, fixing it. Costectomy, taking out a rib. There are actually people, especially female athletes, who have a condition where a rib is impinging on their ability to take deep breaths, and they actually can have a rib removed. Cranioplasty, fixing your head. Craniotomy, making a hole in your head, usually to let pressure out. Discectomy, taking part of his disc out. That's what, Judy had done. The part that was bulging out was shaved off. Laminectomy, part of the lamina of the vertebral arch. Maxillectomy, have to be for cancer, I would imagine. Meniscectomy, I had part of my menisci shaved out when I was having my ACL replaced because I had athlete's knees. Surgical puncture to aspirate fluid. Yep, C. Arthrocentesis. Myography. Sew up a muscle. Osteectomy. Remove some bone. Osteoclasis. Breaking a bone. So, somebody comes in that didn't set their bone properly. They have to re-break it so they can set it in the right place. Patelectomy. Remove your patella, your kneecap. Phalangiectomy. Taking off a finger bone or more. Ratiotomy. Cutting into the spine. Remember, ratioschisis is spina bifida. Spondylocendesis. This is another term for vertebrae. Desis is fusing. So you got to fuse. If you've had 3 operations on your lower back, it still hurts so bad you can't get out of bed. Let's fuse those vertebrae and see if that helps. Synovectomy. Remove synovial fluid or part of the membrane. Tarsectomy. What are your tarsals? Ankle bone. Taking out some or all of an ankle bone. Tenomyoplasty. Tendon and muscle. Tenorrhaphy. Sewing a tendon back together. Ruptured Achilles tendon or something. Vertebroplasty. You might have to do that if you had vertebral spinal stenosis. Got to fix it, so it can go through. Herniated disc. Discectomy. Cutting that part off. Diagnostic terms, arthrography for looking inside a joint. When they do your knee these days, in the olden days you'd wind up with a scar this long if they did an ACL replacement. But now you've got like 2 tiny holes here and 2 tiny holes here. And what they do is they make these little holes and they pump it full of saline. So your knee blows up like this. And they can see in there with a scope. With an arthroscope. Arthroscopy. Electromyogram looks at muscle electrical activity. Visual examination of a joint. So it would be what? Arthroscopy. That's probably Judy calling and say, what the heck is going on? Yeah, so the examination, the scope is the actual machine that you use. Okay. Arthralgia, we know. Atrophy means lack of development, or what it usually means is a loss of bone or muscle or something. Bradykinesia, lack of movement, slow movement. Carpal wrist, clavicular clavicle, costochondral. That's what she was doing here. That's the rib cartilage. Cranial dyskinesia, improper or painful movement. So if you have a what's called an antalgic gait if you're unable to move right, or it really hurts to walk or hurts to move. Dyskinesia. Dystrophy, lack of development or improper development. Femoral, humeral, hyperkinesia, too much movement. Hypertrophy means an overgrowth, although you want your muscles to hypertrophy if you lift weights. Iliofemoral, referring to the hip joint, really. Intercostal, between your ribs. Remember, inter is between. Intervertebral, the disc that's between the two vertebrae. Intracranial is inside your head. Intercranial is what we're doing right now. Between our heads, we're like, sharing this information. Ischiofibular. Well, you have an ischiofibular ligament because your hip joint is like this, and you have ligaments coming down from the ilium, from the pubis, and from the ischium. So you have an iliofemoral ligament, you have a pubofemoral ligament, ischiofemoral. Dystrophy means abnormal development. Lumbar refers to the lumbar area of your back. Lumbocostal, you have ligaments and muscles even that go from your lower back up to the ribs that help extend your back. Lumbosacral, same thing. Myalgia would be what? Muscle pain. Osteoblast, that's the cell that makes bone. An osteocyte is a mature bone cell that's already been made. Osteonecrosis. Necro means to die. Bone death. Pelvic, referring to the pelvis. Pelvis sacral, this area, lower back. Pubic, pubofemoral. Radial, the radius. Sacral, the sacrum. Sternoclavicular is the joint between your sternum and your collarbone. That's a joint that can be damaged. Now I don't know what else could look like a sternum besides a sternum. Sternoid. I've always kind of wondered about that one. Maybe it's in the book somewhere. Subcostal means beneath the ribs. Submandibular means below the lower jaw or behind. Submaxillary, behind or beneath the upper jaw. Subscapular, underneath the shoulder blades. You could have subscapular pain that you can't get to because the scapula is in the way. Could you really try to get your fingers behind the shoulder blade and do something? Substernal, you can have substernal pain if you're having a heart attack or indigestion perhaps. Suprapatellar, above the knee. Subpatellar. Suprascapular, on top of the shoulder blade. A lot of back rubs happen there. Symphysis is adjoining. Tibial, the tibia. Ulno radial, that's the connection here between the ulna and the radius. And that's, you have a little spinning head there that spins around and allows you to make this kind of motion. You have like an ulno-radial intersection there that allows you to move your hand with pronation and supination. Vertebrocostal is where the ribs attach to the vertebrae. Let's take another quick break. If Juicy thinks that showing has to be today at 4, she's right now panicking. So I'm going to... All right, to continue. Chiropodist is a foot doctor. So is a podiatrist. The term that's used much more is podiatrist. What's iatro? Remember that? Medicine or medical related, so chiropractic, we know what chiropractic is. Crepitus is a crackling noise that usually means there's either fluid or even gas in there. And if you have some kind of condition that's producing tiny little bubbles in there and you do this and it goes like crackle, 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 crackle.
Is that kind of also lending itself to if you pop your joints too? Or is that
Well, not really. I mean, popping your joints actually releases a little gas pocket as well. But crepitus is more of a crackling noise when you rub on it, or even if you do this and it goes, which most of my joints do these days. Orthopedics, that is dealing with the musculoskeletal system primarily. It's not made from a word part really, because what does pedics mean? It sounds like, well, but no, that's pod. Not well, it is sort of, but it doesn't mean that they work with feet. An orthopedic surgeon does backs and hips and knees and elbows and shoulders, and so again, these are not exactly built from word parts. It sounds like they are, but if you try to actually make the definition perfectly, it doesn't work. Yeah, a pediatrician, that makes more sense. I mean, that works better. That's kids, that's children. But an orthopedic surgeon isn't a kid's doctor. They work with making you straight. Orthopedists. Orthotics are active things you put in your shoe to correct your gait or whatever. An osteoclast, that's the bone cell that actually breaks bone down for two reasons. You need to release some calcium into your blood sometimes to keep your calcium levels okay. And also, if you have damage to a bone, it'll heal with a lump on it, and then you remodel it, and the osteoclasts eat away the bone that you don't need anymore, and it winds up straightening it out pretty remarkably sometimes. An osteopath. It's a doctor of osteopathy or osteopathy, and it's kind of like being an MD. I mean, some doctors at hospitals are DOs rather than MDs, but they deal more with musculoskeletal issues. They're not internal medicine or, that kind of stuff. Doctors specifying in joint manipulation, surgery, whatever. A prosthesis is an artificial part, artificial leg, artificial head. Rheumatologist, rheumatic diseases, the autoimmune diseases such as rheumatoid arthritis. Hello. Abbreviations: C1 through C7, T1 through T12, L1 through L5, S1 to tell you where you are along the spine. That's important. Carpal tunnel, doctor of osteopathy. Electromyograph, maybe the last X we're going to wind up with, the FX for fracture. Herniated disc. This isn't a medical doctor. This is muscular dystrophy. I keep trying to say multiple. Myasthenia gravis, osteoarthritis, rheumatoid arthritis, total hip arthroplasty. That's a hip replacement. A friend of ours who's 50 or so just had one of those. Hip replacement. She's doing pretty well with it. Okay. Orthopedist recommended that he have an arthrodesis from an ankle fracture. So what are they doing? What are they doing here? No, that's chlasis. Remember, an osteoclast breaks apart? They're fusing it. Yeah, they're fusing a couple of bones that didn't heal properly. He severed Mrs. Diaz, obviously a different patient here, severed a tendon by accidentally walking through a glass patio door. Tenorrhaphy was performed. Electromyogram can assist sufficient muscular dystrophy. You can look and see. See, I said muscular that time. To see if you're getting the right amount of muscle electrical activity out of whatever muscle you have. So here we get to look at a lot of terms here. A cranial laceration, cut your head. The intercostal muscles between your ribs. Pain beneath the ribs, behind the ribs. Herniated disc. Intracranial pressure, pressure inside your head. If you bang your head and it starts to swell, it's a problem. Femoral artery. Ischiopubic area, so that would be between the ischio and pubic bones. Sternoclavicular joint. Arthritis. Degeneration of the bone at the joints. Rheumatoid arthritis, a swelling of the capsule around the joint big time, and generally this kind of lateral deviation of the fingers. The bursa, nice bursa right there. It ruptures pretty easily if you whack your elbow really hard. I'm playing volleyball, you know, I dove and dug up a ball one time and hit my elbow really hard on the floor, and I hit it plenty of times before, but not hard enough to break the bursa. This time it did, and I had a softball-sized lump on my elbow, and it was the hardest thing to keep on playing because it was hard to use it. And the bursa never actually healed back. I can feel the bone there in a way I don't feel it over here. There's a little pad there that kind of hides it, and here the bone is just totally exposed. Bursitis, an inflammation of that bursa. Chondromalacia, in this case it's behind the patella, so this articular cartilage here is softening and wearing away and causing inflammation and pain. Cranioschisis. Looks like the cerebellum is outside the skull. Discitis, just an inflammation of the disc. Inflammation causing deterioration. Inflammation is part of the healing process, but only if it's short. Long-term inflammation causes tissue changes. Fibromyalgia, it's everywhere, it's everywhere. Kyphosis, lordosis, and scoliosis. Multiple myeloma, cancerous tumor in the bone marrow. Osteochondritis Dissecans is a condition where desiccation or dissolution of the muscle and articular cartilage causes pits to appear in the... Yeah, that looks like, yeah, no, that's probably going to be the elbow. Yeah, because remember the fibula doesn't make up part of the knee joint. It's off to the side. So this looks like the radial head and the ulna there. Osteomalacia, rickets, softening of the bones. Osteomyelitis, it's an infection of the bone, works its way into the bone marrow, so the bone and bone marrow, and it can be extremely serious, wind up causing leg amputation and stuff. That's why they're always so careful if a bone gets exposed. You don't want the infection to get inside the bone. It's really hard to correct it. Osteopetrosis, turning of the bone into stone-like hard structures. You can't move around, and it produced big scoliosis in this kid too. Osteoporosis of the bone, not the muscle, reducing the amount of bone tissue so that it mostly spaces and becomes very fragile. Likes to happen at the head of the femur, so that breaks off. Likes to happen around the acetabulum, so that shatters. And likes to happen in the spine. Some really bad places to have breaks and collapse. Yeah.
So it wasn't because she, fell and broke it. It's when she
It broke and fell. Yeah, and in the really old people with osteoporosis, that's, like half of the time the bone breaks and causes them to fall. They don't break it because they hit the ground. It broke just because they were walking on it and stepped hard or twisted or something.
I never knew that. When the surgeon said that, I was like, what? Yeah, she didn't fall and break it. It broke and then she fell. She had a partial hip replacement.
Mm-hmm.
Really well.
Yeah, and at that age, that's amazing to tolerate that kind of surgery. 90s. Spondylolisthesis. Spondylolysis is just a degeneration and collapsing of the disc. Spondylolisthesis is when it displaces. Ankylosing spondylosis or spondylitis. So ankylosing means stiffening, bending, and the spondylitis is inflammation of the spine. A very famous set of photos of the same guy. 1947, 57, 67, 1972, and then some treatment actually allowed him to stand up a little bit better afterward. But you can see every 10 years how this disease was progressing. Bunion, hallux valgus. This is a valgus turn. The hallux is your big toe, and there's the bunion. And they had it surgically fixed. People get those fixed a lot. Carpal tunnel we saw. Cole's fracture on the end of their radius. Landing with your when you take judo, they teach you never fall with your arms outstretched. You fall with your arms like this, and you catch yourself and absorb it this way. You don't go because that could break your wrist or dislocate your shoulder or break the acromioclavicular joint up here. No, dislocation is actually the term they use. Gout, especially on this side, swollen and red, base of the big toe. Herniated disc we saw, or herniated nucleus pulposus. Lyme disease, hard to get rid of. I mean, people that have Lyme disease, it takes, a year sometimes of antimicrobials and stuff to get rid of that. Muscular dystrophy, gradual deterioration of the muscles that causes a distortion of the body and a lack of ability to walk and ultimately to breathe. Rheumatoid arthritis, once again. Herniated disc. It hasn't quite ruptured, but it's moving through. It's trying to get there. Arthrocentesis, drawing out synovial fluid to see if there is infection or something in there. Craniotomy. Discectomy, we saw before. Laminectomy, removing some of the bone around the spinal arch, the vertebral arch, so that the spinal cord can go through better. Meniscectomy, scraping out. This is cartilage. It doesn't heal. So you just have to take out the rough stuff and make do with what's left over. Arthroscopy, electromyograph, putting electrodes on the muscle, and then you move the muscle and you see how much activity you get. All right. To the computers.